Hello, this is Laura from Emerge Pediatric Therapy, and I wanted to talk to you today about vocal hygiene. So the same way that we eat healthy to keep our bodies healthy, or we brush our teeth to keep our teeth healthy, it's really important that we practice vocal hygiene to help keep our voice healthy. So this is something that both adults and children can work on to improve their vocal hygiene habits and make their voice feel and operate a lot better. So before we start talking about things you can do to improve your vocal hygiene, it's important to understand what structures we're talking about. So right here in your neck, where a lot of people can feel their Adam's apple, is your larynx. And within that larynx are some vocal cords, which are tissues that move together like this when you push air through your lungs to help create your voice. This is referred to as your voice box, and there are lots of things we can do to make sure that the vocal cords within it stay healthy and happy. Just like any other part of your body, your vocal cords can get damaged and they can swell, which can cause your voice to sound breathy or hoarse. So if you notice that you or your child have a breathy or hoarse voice, you can implement a couple different strategies to help improve that vocal hygiene and help your voice sound a little more clear. There are 5 easy strategies that you can implement to help with your vocal hygiene at home that we're going to talk about today. One is staying hydrated. Your vocal cords need lots of moisture and hydration, just like any other muscle in your body would. Number 2, you can teach your child strategies to stop them from clearing their throat or coughing, because anytime we go like this, it causes our vocal cords to hit together really hard, which can cause some damage. So teaching them strategies such as deep breathing or taking a sip of water can help reduce those habits. The third thing that you can try is reducing background noise. So oftentimes children will talk louder, which is not as good for their voice if there's a TV in the background or other siblings. So trying to reduce that competing noise can be really helpful. Number 4 is avoiding irritants. So making sure that your child isn't exposed to very much dust or aerosols can help with that vocal hygiene and help your vocal cords feel better. And number 5 is reducing vocal volume. So teach your child the difference between an inside voice and an outside voice in order to work on making sure we're using that just right level to keep our voices healthy. If you implement these strategies and you do not notice improvement in you or your child's voice and how hoarse or breathy it sounds, then voice therapy might be a good next step. So speech therapists can work with you to work on reducing tension and strain in your voice, to work on improving that breath and speech coordination, and then also work on vocal volume. So these are strategies that go above and beyond some of these initial easy to set up things to help improve your vocal hygiene.